You may think of hospice care as support for seniors, but that's only part of what services include.
And we've talked with Islands Hospice about options for help and myths about what that means.
If you're a caregiver and need support, now is a good time to reach out. November is National Hospice and Palliative Care Month, and joining us from Islands Hospice is Sean Reeks, Director of Community Outreach. Sean, thank you so much for joining us on Living 808.
Absolutely.
You know, this is such an important topic that so many families are faced with, and to raise awareness about hospice care for those coping with life-limiting illnesses, what are some of the common myths surrounding hospice care?
So yeah, of course, and thanks for having me today. So going on 9 years working in hospice, and it's funny when you're a kid, you don't say, oh, I'm going to work in hospice when I grow up, but here I am, so happy to be here, wouldn't have it any other way. I've met with hundreds and hundreds of families, and some things that I hear commonly. Myth number one, hospice is a place, when the reality is that hospice is a service that can be provided wherever a person calls home. Most of our patients are receiving services in their very own homes. Some could even be watching today. Myth number two is that hospice care is expensive, when in reality, services are covered 100% by Medicare, Medicaid, and most private or commercial insurance plans. And I think that's particularly important during these times in which many of us are facing financial situations having to do with the effects of COVID-19.
Absolutely. Can you give us a broad idea of the type of services that you help with through hospice care?
Sure. So I could spend an hour talking just about that. And so I encourage our viewers to reach out for a more thorough informational consultation. When you're on our services, when you're on hospice services, your care is still overseen by a doctor of your choosing. You're going to have a care team making visits to your home, nursing visits, visits by CNAs providing personal care needs such as bathing for your loved one, access to social work services, spiritual care services, things like medical equipment, medical supplies, medications, and then 24-hour availability to our patients. So we are in our patients' homes 24 hours a day, but we're available 24 hours a day if there's a medical need. And of course, like I said, all of this covered by insurance and provided in accordance with a person's individualized plan of care.
Right now, of course, there's a lot of isolation. How has COVID-19 affected hospice services?
Absolutely. So we remain fully open and operational, and we have since the onset of the pandemic. We are in the essential health services category. You know, there's no working from home when you're a home hospice nurse. There's no working from home when you're a nurse's aide. And so we are open, we're fully operational. And of course, we, like many, if hopefully most healthcare providers, have implemented stringent COVID-19 policies to protect our patients, their families, the community. Self-screening. Each staff member is self-screening every single day. And of course, PPE, a term many of us probably hadn't heard a year ago today, personal protective equipment, utilizing that in the best ways possible to prevent the spread of infection to patients, families, the community, and to protect our staff too. They're the ones on the front lines. And I gotta say, we've done an excellent job of doing these things.
Sean, who would be a good candidate for services?
So the truth is that only a formal evaluation can determine whether or not a person is appropriate for services, and that no doubt involves a person's doctor and or doctors. But I would like to turn my attention directly to our viewers now, if I can, many of which are at home caring for loved ones. I've read recently that, and this is something I've read in multiple places, that the rates of stress and anxiety and depression have increased exponentially during the pandemic. And no doubt caring for a loved one with declining health is challenging regardless of being in the middle of the pandemic. So what I want to tell our viewers who are at home caring for a loved one is you don't have to go at this alone. There are resources such as hospice available to you. If you have a loved one who's having declining health, perhaps they are sleeping more, if you've noticed they're eating less, perhaps they've had unplanned weight loss, in and out of the hospital for a multitude of reasons. Perhaps your loved one has been hospitalized multiple times this year for infections, hydration, frequent falls, shortness of breath. Or maybe mom, you've just noticed, is getting weaker. She used to be able to get up and down the stairs, now she can't. She used to be able to get out of bed and get dressed, now she can't. There are resources available to you, and we hope to be one of those resources. And so it starts by gathering information and reaching out to us if you're able.
Sean, how can families learn more? The best way to get in touch with you?
Certainly. So we service Oahu and Maui. You can call us at 550-2552. You can visit us online at islandshospice.com. And I say it's islands with an S, islandshospice.com, or you can find us on Facebook too.
Well, thank you so much for joining us and telling us about these services, which could be so helpful to so many families. Of course, we'll post all the information on our website, KHON2.com.